Good morning, Patrick coming to you here live from Complete Health. For the first time, I've never known this, but for the first time I've actually just found out that we as chiropractors are recognised and advised upon on the NHS's website. I've been practicing for it's coming up to 5 years, and I've never known that actually the NHS has a section for us on their website. I've actually attached the link in the description. But the NHS have actually recognised chiropractic for the management of neck pain, back pain, shoulder pain, elbow pain, and the management of osteoarthritis. Now, the reality is true that we manage much more. And if you go to the Advertising Standard Agency, they will tell you the list of different things, including stuff like sciatica and radicular pains and balance issues and reducing risks of falls and managing pain syndromes. And they'll tell you all the different things. But the fact that our NHS is actually recognizing chiropractic care as a form of therapy for correcting and maintaining and reducing the risks of neck pain, back pain, elbow pain, shoulder pain, and osteoarthritis pretty much tells you that they're confident in the work that we do. They're confident in the work that we do. Now, like I said, we are not limited to those things, but to be recognized by our NHS generally means that they think it works. They think it works. Now, even though chiropractic care is not readily available on the NHS, we've known for years that it works. And a lot of people never really understand why or how chiropractic actually works. So, essentially what we know we have sitting inside of our brain, inside of our head is our brain, and running down the middle of the spinal column is our spinal cord. When we look at the way that the spine is working, if we start to distort or change the movement or position of our spine, it starts to create pressure not only on the spinal cord and the spinal nerves, and starts to cause tensile forces within that spinal column. It actually also starts to irritate all the stuff that's attached into it. So stuff like the ligaments, the muscles, etc. Which, let me ask you this question. If we're standing with incredibly poor posture and have huge muscle imbalances, where certain muscles go tight, the joints start to lean in awkward directions, would you or would you not expect to feel pain? It doesn't take a rocket scientist to work out that if I create a lot of torque, stress, and pressure on either a joint, a muscle, or a nerve, that tissue is going to become irritated. Now, by adjusting and moving and creating better movement and position in the spine, we start to see that pressure and tenseness move away, allowing the system to go into a better state of ease. Now, typically, the way that the NHS would recommend our care and how chiropractors will typically recommend care are very different. They will recommend very much a pain management, whereas chiropractic is more likely going to recommend a longer term preventative and corrective type form of therapy. So a lot of the time we have to tell you what you need to hear as opposed to what you want to hear. But it's really good to see that the NHS actually recognizes us as a form of therapy that you could use in order to actually reduce or resolve your problems. So if you want to have a little look, like I say, I've attached the link. It's very limited information, but I've never known that the NHS has ever had this on their website, because I've actually checked before and I've never seen it. So it's really nice to see that we are recognized as a form of therapy that we can help people with the following conditions. But if you want to see a more robust list, the Advertising Standard Agency, or simply just ask us in the clinic, there are tons of different problems that we are actually allowed to say that we manage. Stuff like headaches, we can say that we help to prevent in the management of tension headaches and stuff like migraines. We can say about sciatica and low back pain, sports injuries, etc. There are a lot of different things that the NHS hasn't got on its website, but it's really nice to see that they actually do have something about us. Guys, I will speak to you guys again tomorrow unless I see you in the clinic soon. If you have any questions, again, please leave them in the comments. That's what I'm here for. Until tomorrow, take care.